Good morning, everyone, and welcome to the Health Committee meeting for the County of Renfrew. It is September 9th, 2020. It is 9:30 a.m. I am going to call the meeting to order. With that, I will ask, has the roll been called?
Everyone's present.
Everyone is present. Thank you very much. Are there any disclosure of pecuniary interest, and if so, the general nature thereof? The chair recognizes none. Can I have the minutes of the meeting held August 12th have previously been circulated with the agenda package? Everyone has been afforded an opportunity to review them. Can I have a motion to adopt the minutes of the August 12th, 2020 meeting? Councillor Love, seconded by Councillor Regier. Errors, omissions, comments? All in favor? That is carried. Thank you. With that, then, the housekeeping has been taken care of. We will go directly into the Emergency Services Department report, and I would invite, please, Chief Nolan, if you can take us through the report.
Great. Thank you, Mr. Chair. To you and members of the committee, good morning. It's nice to see everybody back on the screen today and be able to walk through what is a kind of an interesting time in COVID history. I think we're all feeling it right now, related to item number one in terms of our update, because with much of the summer spent on ring fence long-term care and doing swabbing in the community for long-term care and then asymptomatic testing as well, we've certainly shifted the surge associated to resumption of daycare and resumption of schools. So I spent yesterday at the Renfrew swabbing center and certainly saw a significant number of the people going through there in car seats, being able to either sort out whether their symptoms are COVID related or not, or be able to be cleared to be able to go into daycare or schools. So it's really shifted a bit of our focus in terms of who our population is and what the needs are. The drive-through certainly works exceptionally well for children as well, because you're not making them stand in the rain for 3 hours to then be swabbed, and all the anticipation that would come with that. You can drive up, be listening to Barney on your stereo and be able to get a quick swab in and out as part of the process. So I've instructed staff to go out and get some gold stars so that we can congratulate the kids for being such good sports, getting a very long needle and a very short nose. When we look at some of the challenges associated with the surge and what it's meant to our entire department, certainly when the assessment centers were initially stood up, it was all based upon an application that was submitted by the Renfrew Hospital on behalf of all of the partners of VTAC to be able to move forward. So the strict relationship is between the Renfrew Hospital and Ontario Health. So Ontario Health gives the money to Renfrew Hospital. Renfrew Hospital then disperses the funds based upon the initial and the subsequent proposals related to costing in that. One of the challenges that I want to put before everybody is that the province has yet to pay any assessment center in the province for their work. And the anticipated date to receive an answer from the province about how the funding is going to flow was to have been done by the end of August, and that was based on speculation. But what the province is now saying is, before we re-gear our assessment centers across the province, and this fits into the VTAC conversation, we want to reconcile all of our accounts as they were pre-approved. So there is a letter between Ontario Health and Renfrew that says, as per your application, go forward. Now we're just waiting for the funding. So you'll see, for those of you that are on FNA, that's going to come up at the FNA report. So to be clear, we have submitted our costs to Renfrew Hospital on a regular basis, and Renfrew Hospital fully anticipates getting 100% remuneration from the province. And when they do, that money will flow back to us. And that's been the model, as it needs to flow to the family health team for the medical receptionists and so on within that program. So looking at the assessment centers, we are now looking at trying to winterize our activities within those assessment centers. So we're looking at a couple of recreation facilities around the county whereby we'll still have a drive-through model for as long as we can, but that we'll be warming up and managing our administration within the building so that we can have temperature control, for example, on the specimens themselves and the swabs, and a little bit of temperature control over our staff, being able to cycle through and be able to manage. I think partly the expectations, our throughput right now is sitting at about a person a minute at our assessment centers, which is pretty spectacular. So when you drive up, if there's 20 cars ahead of you, you're probably looking at about a 20-minute wait maximum to be able to move through that line. And yesterday, for example, in Armpire, we ran 2 parallel lines, one for pre-registered, one for unregistered, and we were putting through about 2 people a minute in that model. So the feedback that we've received has been resoundingly positive about the efficiency, the kindness of staff, the techniques that are being used, and I think the ease of which we're making this for the population. And from a practical perspective, it's very good for us because we are not having to disinfect a building or an arena and manage the infection control that comes along with that. We've got it down to, I think, quite a science now of being able to manage not only the clinical process, but also the weather, the traffic, the people, and the registration process, up to and including Jeff Dodge, one of our paramedics, who was able to innovate. And if any of you have been through recently, you now get your health card and you hold it up. We scan that and that auto-populates the requisition without having to touch anything. So we're able to do much of the registration on site immediately now. So other areas are looking at the technology that we've been able to implement. And then lastly, sort of within the department, we're all still working a little bit nomadically. So we have admin staff working from Renfrew County Place. We've got admin staff working remotely. We're moving staff in and out as little as possible so as to not cross-contaminate within our workforce. But a big thank you to social services, because they've been a very charitable partner in giving us some space, both in Renfrew and in Armpire, and that's been incredibly helpful in terms of managing both the administration, but also managing my staff's expectations in terms of access to the internet and the other services. So we've got a nice little partnership going, and a big thanks to Laura and her team for working with us on that. Item number 2 related to the virtual triage and assessment center. We've posted the schedule there within the committee report for you. As you can see, we are moving things around a little bit in that we've added Douglas. We certainly have a population there within that community that has transportation, long distance transportation issues. So we are very interested in working with that population and providing COVID testing local for them, but also being able to move it around. It applies to seniors, people that are challenged in terms of distance and time. So we're hopeful that today's clinic this afternoon in Douglas goes well despite the weather, and that we'll get some folks out for that. I should point out as well on the testing schedule, when we say no testing on Monday and Thursdays, for example, that doesn't mean we're not doing testing. It means there's not public pre-scheduled testing on those days. Those are the days where we're going into congregate care settings, going in and doing quiescent care, for example, or being able to soon likely flex into schools and gymnasiums and other places to be able to do some non-scheduled or outbreak management. So that's the flexibility that we leave ourselves within that. And there isn't a day that goes by Monday to Friday that the team is not actively testing. So I just want to make sure, because it does say no testing, but that's no public testing. Kind of like a swim schedule. It doesn't mean there isn't somebody in the pool. It just means you're not in the pool at that time. And that's the model that we've been deploying, and is a little bit ahead of where the province has even asked us to be to date. Item number 3 is a less good news story, and that is related to the Land Ambulance Services grant shortfall. You'll recall that on an annual basis, we need to estimate what the future year's Land Ambulance grant is going to be for the province. And we've typically done that based upon the percentage that we had received in the previous year. So kind of like the way we do our IT financing, what we use the previous year rolls into what we anticipate the next year to become. So in this year, we had estimated the 4% based upon what we had received from the province as a percentage increase in the previous year within our budget. And the province has notified us that they're only coming in at an increase of 1.2%. So when you look at that related to the actual provincial subsidy versus the budgeted subsidy, there is a numeric error in that. And I just want to make clear that the shortfall is actually 235,646, not 256,646. But regardless, there is a shortfall. And I think that it's important that you're aware of that shortfall. But what we have done as staff is written to the province requesting clarification as to why they're only coming in at 1.2%, when, as you all heard, Minister Elliott's comments at AMO, that there was a 5% land ambulance grant increase this same time period. So it's a little bit bewildering as to why we'd be coming in at 1.2 when last year's actual came in at 4, and the minister has said that there's been a 5% increase within the funding. So I've petitioned or polled my peers to find out. Some got more money than they asked for, some got less money than they asked for. And I think that given COVID and everything else that's going on, it's all that more important that we get as close to that 4% or that 4% to be able to maintain that 50-50 funding expectation that we have. So I just wanted to make sure that everyone was aware of that. Those numbers will be going forward to council as well, because there is an obvious new pressure within our budget now that we're moving into the fourth quarter of the year. And it's difficult apart from trying to identify things that have not yet been purchased, which are far and few between given COVID and some of the supply chain management issues that we've been having, to be able to offset that shortfall of 235,646 from the province. So the strategy right now is to pressure the province to reconsider why they are shorting us compared to the previous year's experience. And as well, look internally to see how much of that we can make up in not spending funding at this stage of the game. I have asked my deputies to consider that. And I can tell you at this point in the year, when we had to purchase the majority of our pharmaceuticals, for example, at the beginning of the year, we know that 80 or greater percentage of my budget is actually related to salaries and benefits. Without cutting service, it's very difficult to find those kinds of numbers at this point in the year when the pressures have never been greater. So I just want to make chair and committee aware of that, and any response that we receive from the province will certainly be forwarded on for further consideration. But I think at the appendices to the document, you can see very clearly that the minister had committed 5% increase. And I recognize that that's across the board, but I'm curious as to where the province is spending that 5% when we're only coming in as a service delivery partner at 1.2. And so with that, Mr. Chair, I'm happy to answer any questions. A number of the letters within the appendices, such as ES2 related to the warden and the VTAC and the Land Ambulance Services Grant, are appended for committee's information, and I'm happy to answer any questions as you see fit.
Thank you very much, Chief Nolan. With that committee, we are going to go back to item number 1, the COVID-19 update. Any questions, comments? I see none. I guess that's COVID normal. Item number 2, virtual triage and assessment center. Councillor Doncaster, please.
Thank you, Mr. Chair. Just a question, it's slightly off topic, but there's a lot of discussion currently around the deployment of the regular flu vaccine this year. I'm wondering if there's an opportunity or if there's been any evaluation on the VTAC being a delivery agent for even a COVID vaccine, but the regular flu vaccine coming up. Thank you.
Of course, I'm completely familiar with the answer, but I would ask Chief Nolan to provide it on my behalf.
Yeah, thank you, sir. and not sitting on the Board of Health. I know that this is a burning conversation there as well. So what I'm encouraging across the health sector, so that's primary care, acute care, public health, and paramedic services, that we look towards a one window approach to vaccination and testing. And I think that that's important, because to ask someone to come out for this vaccine on this day and this vaccine on this day or this test this day, it's an unnecessary duplication of effort in my mind. And the way that we have the efficiency around the COVID testing structured, it seems like an ideal model to both have your COVID test if necessary. We can also do strep test, as we're doing now, and a number of other point of care analyses through the drive-through process. I have spoken directly with Dr. Cushman to say that we have been doing the influenza vaccine for a number of years as a paramedic service. So is this an opportunity for public health to be able to shift some of that more public-facing engagement for vaccination, for influenza vaccination, over to the COVID and paramedic involvement? Granted, it's a slightly different process in that you need to hang around a little bit after you've received your vaccine in case there's any allergic reaction, for example, or any untoward feelings. But we've already mapped out the operational requirement to be able to do that. So really, we're waiting to hear back from public health as to how they would like to approach the flu season, knowing full well that we're prepared to lean into this. And I think there's potentially an alternate funding source there as well, because the province is looking at, for COVID testing, everybody had submitted their assessment center proposals and received the green light, according to Ontario Health, based upon the various funding models that had been put forward. I'm hearing that the province is now interested in funding up to $38 per test. So they're going to a per test reimbursement model, potentially. And I know that, for example, related to the flu shot, there is a per flu shot reimbursement model for nurse practitioners, physicians, pharmacists already out there. So while I'm not interested in chasing revenue sources, I want to make sure that the public has one window to go to take care of all of their seasonal vaccine requirements and testing requirements to be able to mitigate the PPE drawdown. Because if you have 4 different experiences, then that's 4 different N95s or surgical masks and gloves and everything else. Let's just get it all done at once. So the other thing to your question, Councillor Doncaster, is related to what is the VTAC medical reception and physician role in this. And I think we're all going to be challenged with, what does that sniffle mean? What does that cough mean? What does that fever mean going into the fall? And more important than ever is having timely access to good advice. And I think that that's what VTAC really represents from a primary care access perspective. So again, if you have your own family doctor, please go there. If you can't get a hold of your own family doctor or you don't have one, please call VTAC before you present to the emerge or call 911.
Thank you very much for that, Chief Nolan. Any further questions, comments? Warden Robinson, please.
Thank you very much, Chair. Just, I know at our last committee meeting, I talked about hoping to get a delegation in front of Minister Elliott at AMO. Obviously, that didn't happen. Most of you are aware of that fact. However, a couple of positives I'm going to take from that. One of them is that on October the 2nd, we will be meeting, and as it's the royal we, it's the chairs of all our county council committees, we'll be meeting with Minister Yakubuski, and definitely VTAC will be one of the agenda items as well at that point. We've also had the invitation and are taking Roma up on it. Councillor Love has arranged for Chief Nolan, myself, and possibly another physician to do a presentation to Roma in November. We're looking for the endorsement of that association and hopefully keep pushing it further and further throughout the province. I've also had an opportunity to discuss VTAC at length with Mayor LeMay, who has agreed to request a delegation for us in front of the Eastern Ontario Mayor's Caucus as well. So just an update on what's been happening behind the scenes. Thank you very much, Chair.
Well, and thank you very much also, Madam Warden, on the update. It is, I think, part of the larger effort is to be commended in all of these various approaches to ensure that what VTAC is bringing to our community is recognized and will endure beyond the COVID pandemic. Anything further? I will complete. I wish to extend an appreciation to Chief Nolan. Certainly let us refer to them as perhaps the horse and buggy community in Douglas and area. It is much more accessible to be able to receive the test at Douglas. So I do very much appreciate that the service has accommodated in particular that community, but also the larger community within Douglas. Perhaps as my colleague and friend from Pembroke has noted often, Pembroke is perhaps the heart, Douglas is the center. With that then, item number 3, Land Ambulance Services Grant shortfall. I'm going to comment. It is quite disappointing and discouraging because ultimately, as the chief has noted in the comments at the virtual AMO conference, Minister Elliott did in fact confirm the commitment to funding for the paramedic services across the province this year. And given that hours that received by the County of Renfrew paramedic service is 1.2%, then inescapably that other 3.8% has been allocated elsewhere. So it is a curious thing to me, particularly given the challenges this year, that there was such a thing as receiving more than you had budgeted for. So it is quite disappointing. I think that this has been engaged at a staff level at this point. We will see what ensues from that, but perhaps in a month's time, based on reporting that may come forward then, whether there's a requirement to elevate that to a political level as well, I think would be appropriate discussion in October. Anything further? With that then, can I get a motion to, Councillor Murphy.
Thank you, Mr. Chair. I just, on behalf of my community, Chief, I just wanted to thank your crew for their professionalism and everything they did last Tuesday in the wake of such a tragic event.
Chief Nolan.
If I could, thank you for that acknowledgement. And, you know, it's, I think it's also a good stark reminder in terms of the 911 component of the work that the paramedics are doing that's happening on a day-to-day basis. And with, you know, a surge in our population, as well as a number of very unfortunate events that have occurred across the county, you know, it's kudos to your fire department and the OPP and everybody that really stood up and had an exceptional response for the loss that I'm sure is gutting your community as well as the broader community, because these are families and peoples that are impacted. So thank you for that, and I'll be sure to pass that along to the staff from that scene as well. Thank you, Councillor Murphy.
Thank you, Councillor Murphy, and thank you, Chief Nolan. With that, can I have a motion to accept the Emergency Services Department report, please? Moved by the Warden Robinson, seconded by Councillor Grills. Any further question, comment? All in favor? That is carried. Thank you very much. With that, then, I would like to invite Ms. Sheedy to take us through the long-term care report, please. Take it away, Shelley.
Thank you very much, Chair Donoghue. Good morning to the members of Health Committee. The long-term care report starts on page 9 of your package. Items number 1 and 2 are the resident statistics for each of the manor and the lodge as of the end of August. Just remind committee once again that typically our ministry funding is clawed back if we don't maintain a minimum of a 97% occupancy. As a result of COVID and the pauses on hospital admissions earlier this year, the government has advised that that rule will be waived for this calendar year. Similarly, committee is reminded that the respite program is also on pause. That's the reason for the asterisks there. Excuse me. Following along on page 10, item number 3 is the wait list for each of the 9 long-term care homes in Renfrew County. Item number 4 is an update on COVID. While our list is getting a little bit shorter, the content is getting much more complex. Okay, so I'll try and walk you through this. Item number 1 in terms, or the first bullet point rather, under number 4, an update on the status in our 2 homes. As committee is aware, we do surveillance testing with our staff twice a month rather, and that means that they are asymptomatic, but we're testing 100% of our staff that are actively at work. At Bonisher Manor, test swab that was completed on September 2nd. We got that result on Sunday, September the 6th, just passed, and that one of our staff member results came back as positive. Keep in mind, the staff member had no symptoms, and that continues until this day. That staff member was retested on Sunday, and we just got that result back this morning, and it is negative. So next steps are with Dr. Cushman at this point. In conversation with him over the weekend, we did decide to test the residents that lived on the 2 units that this staff member had worked on. The challenge and the reason for that was that the initial swab was taken on September 2nd. And of course, because the staff member had no symptoms, that staff member continued to work until the 6th. And so that staff member had been exposed to a number of residents on 2 different units. And although that individual wore the proper PPE at all times, again, taking the abundance of caution approach, we did decide to test those residents. So having said all of that, we do have 65 residents at the lodge results that we're waiting to hear on, because again, those just occurred on Sunday. The Miramichi Lodge only has 1, and that's related to a new admission. In terms of staff, Bonisher Manor has 58 test results that we're waiting on, and that's surveillance testing, so no symptomatic. And Miramichi Lodge has 139, and again, that's all surveillance asymptomatic testing. The next point is regarding family visits to the long-term care homes. Committee knows that since the onset of COVID, we've been doing virtual visits. And then when the weather got better, we added window visits and then outside visits. And more recently, as of mid-July, indoor visits. Added to that, the County of Renfrew Homes decided to trial, because you may recall last month I had advised that the indoor visits were happening in designated spaces because we had to screen and teach, particularly as it relates to donning and doffing masks, proper hand washing, et cetera, et cetera. In order to try and make the visits as meaningful as possible, we decided to trial indoor visits in residence rooms where the resident lives in a private room, because we knew we could ensure physical distancing in those instances. So that has just been implemented. It's going well. We're going to continue to reassess that. And if we can accommodate then as a next step, visits happening in the shared rooms, as long as again, we can meet the physical distancing requirement, then we will do that. However, added what's new as of since last month is on September the 2nd, the ministry did provide further information, and that's attached as Appendix 1 in your package on page 14. And it was intended to be a clarification of visitors, and I don't in any way mean to infer that that's made it more simple for us. So I will say it this way. There are now 4 categories of visitors. And so there's very distinct definitions and different rules in terms of screening, COVID attestation, etc. So there are essential visitors, there's support workers, there are caregivers, and then there are general visitors. And then I'm going to just move ahead to because it follows that the next issue is the the 4th bullet point related to resident absences. Later this month, the government has advised on what they're calling, it was at the end of August, short stay and temporary absences. So in a nutshell, short stay absences are less than 24 hours. Temporary absences are more than 24 hours. And there's quite a difference in how we monitor and react to those short stay absences. Other than the resident and the person that's taking them wearing a mask when they're out, if tolerated, there's really no rules or protocols to follow when they come back into the home. We are concerned about that because residents can be out in all kinds of different situations and exposed to all kinds of different risks. Our only requirement is to screen them upon their reentry, which we do twice daily anyway. So it's really nothing new. Whereas if a resident stayed out for more than 24 hours, i.e. stayed out in a family member's home overnight, as pre-COVID many of our residents did, they have to be self-isolated for 14 days. So that's quite a difference in the 2 types of absences. Going back to the 3rd bullet, which is the preparation for the 2nd wave, as I had indicated last month, we were provided with a very specified format from Ontario East Health to submit by the end of August, and that was done. We did consult with our resident and family councils as well as our joint occupational health and safety committees before those were submitted, and they are attached for each of the homes. Bonashire Manors starts on page 17, and Miramichi Lodges starts on page 42. You will see in the comments section that I took the opportunity to make sure that our comments were well aligned with the long-term care position paper that was presented to Minister Fullerton through the AMO delegation. And that is to say, to really underscore those risks, PPE, staffing shortages, the one employer rule, the ability to hire a resident aid type position, more funding, etc. Moving ahead to page 11, there's a picture there of one of our resident families, and I wanted to capture that to really underscore our appreciation of families and residents that are taking the risk and potential risk to others very seriously. So while this is a beautiful picture, the family member did emphasize to us that she and her father wore a mask throughout the visit and did physically distance other than when they were eating. So we very much appreciate that. The last bullet on page 11 underscores or emphasizes more of the details related to the temporary absences. And then moving on to the next bullet point on page 12 is staffing. And for a variety of reasons, we are experiencing staffing shortages, really unprecedented. As everyone has said, staffing in long-term care has been a challenge pre-COVID, so no surprise to anybody that is going to be a challenge during COVID. But more recently, certainly during the month of August and moving forward, we've seen an increased challenge. Some of those reasons are primarily related to the fact that we have had a number of students that have been with us since, mid-April, working as PSWs or resident aides that are now going back to school. And because of the one employer rule and related to specific direction from the health unit in terms of student placements, they cannot be in, let's say, an RN or RPN program doing a clinical placement at a hospital and then come and work for us on the weekend, which many of our students do. And they've been a great help for us, particularly on the weekends. So that's a big loss to us. It's one of those risk benefit, we certainly subscribe and endorse the one employer rule for all the right reasons, but this is one of the challenges. Added to that is, as our admissions have ramped up, we have to do the 14-day isolation. And if we had any temporary absences for those as well. And again, that's using up a lot of our staff because often we have to assign one-on-one staffing to make sure that the proper PPE and the isolation is being maintained. Added to that is screening. We certainly try to use any staff that maybe need to be accommodated right now, aren't able to do their regular job, those kinds of things. But on the good news is we're running short of that. The bad news is we're having to pull frontline staff in order to do screening, keeping in mind we're screening all of our staff twice daily and all of the residents twice daily, and now all of the different types of visitors. Added to with the temporary absences and the short stays, the education component that we are required to fulfill with all of the visitors is much enhanced. So for all of those reasons and a bit of a vicious cycle, because in an ideal world, I would have probably had a business case for you today, but we simply did not have time to get that done, especially with how early committees are this month. But I do anticipate bringing a temporary business case to you as soon as I can get it done, that would look at some sort of increased hours in some sort of fashion to get us through the next few months. And finally, the last bullet point is a temporary pandemic response division that the Ministry of Health has set up, and the details of that, it can be found on page 68 of your package. Mr. Chair, moving on to the next item, which is number 5, is an information item from the City of Port Colborne, who passed a resolution regarding funding and inspections of long-term care homes, and that's attached as page 70 in your package. Item number 6 is the July Treasurer's Report for each of Bonnechere Manor and Miramichi Lodge, and they are attached. I don't think I included the pages, but I can quickly figure out what those are. The Manors starts on page 72, and the Lodges starts on page 79. I did want to highlight, because this is July, that the pandemic pay funding was not paid out until August, so that'll account for most of the surplus that you see. Item number 7, as I did indicate to you verbally last month, and I'm very pleased to see Shelley is on the call with us. I wanted to do a formal recognition of Shelley Yantha, who unfortunately for us has tendered her resignation. So Shelley's been the Director of Care, yeah, I know, sad, here at Bonnechere Manor for the last 7 years. And I've had the honor of working directly with her for the last 4 years that I have been at Bonnechere Manor. And I can tell you that she has been an excellent Director of Care. I'm most impressed with how she has mentored the registered nurses that work at Bonnechere Manor. And you will know her mostly through the quality improvement plans that she brings to you every March. And I know she has spoken to you previously about the champion model that she has implemented here at the Manor. And that's to say that each of the RNs have at least one project that they champion. And so whether that's falls prevention or pressure ulcers or infection control or what have you, palliative care, et cetera, it's a great leadership opportunity, and it really instills accountability amongst our registered staff such that again, as I mentioned to you last month, while we are recruiting for a director of care, I've temporarily appointed Tricia Michaelis, one of our resident care coordinators, to cover in the required DOC position. But I felt the need to also replace Tricia, given that we are in the middle of a pandemic. And, so we put out an expression of interest to our registered nurses, and we had a very big response from them and a very difficult decision given the leadership skills that Shelley did mentor amongst all of them. So very pleased to advise you that, oh my gosh, I think her name has just escaped me. I know Shelley will remember it. Michelle McCann is our new acting RCC during the recruitment. But I also wanted to give kudos to Shelley in terms of our successful result with the accreditation with exemplary status. There's no question quality and quality improvement is Shelley's forte. And, that's never more apparent than when you go through the accreditation process, because as you will recall, it's all about rising to national best practices versus provincial minimum standards. And so, as you know, Shelley has accepted a position as an administrator with North Renfrew Long-Term Care Home. So I'm very pleased she's staying within the Renfrew County Long-Term Care Home family. And on a personal note, I'll get to continue to work with her as a colleague. Moving on to fundraising, again, we have the Butterfly Garden still up and running, and no frills. I'm able to advise you on the amount that was raised, and that was just short of $1,500. So very appreciative from them. And again, we will be having a virtual coffee house fundraiser in lieu of our galas, and more information to come on those. And if you have any questions in the meantime, please don't hesitate to contact Lainey. That, Mr. Chair, is my report for the month of September.
Thank you very much, Ms. Sheedy. I will just step somewhat out. I'm assuming that was a hand raised and not a wave. I will invite perhaps Ms. Yantha if she wishes to comment here.
Thank you. And it's funny when you're hearing that you're actually leaving, it brings a little bit of emotion, so excuse me. But thank you very much, Mr. Donahue and the committee. I can only say, the last 7 years was an amazing experience, and it can only have been done with the resources and the support that the County of Renfrew has provided me, specifically, of course, Bonisher Manor. I've met some wonderful people, and certainly the political aspect has really raised the bar for me as a leader, and I'm really hoping to continue that leadership or start my leadership as an administrator. Just really, I just can't thank you guys enough for the experiences. And I'm sorry if I'm a little emotional. It's bittersweet. It's a great opportunity, but I know that working with you, and thank you, Shelley, as a colleague, and being part of Renfrew County, I'll still be able to work with such wonderful people and really start advocating. And really, we know the future is going to be a changed world for long-term care, and to be part of that is exciting for me and an opportunity. So thank you so very much, all of you, and good luck. God bless. Stay well. Thank you.
Thank you very much, Shelley. I'm most appreciative also of you being able to join us this morning for this committee meeting. And as is in the report, and as I have certainly expressed to Ms. Sheedy, enormous gratitude for all of your years of service here, and certainly picking up on Shelley's comments. enormously grateful that your level of professionalism and competence is now going to be taken elsewhere within still the confines of Renfrew County. I think it is probably a blessing towards Councillor Doncaster's community to have such a capable person now taking the helm in Deep River. So congratulations on your position, and thank you for all of your service here to the County of Renfrew Long-Term Care homes. With that, Councillor Doncaster, please.
Since you took the opportunity, I will also. So I'd just like to take a brief moment to thank Shelley, for all her work at the county, and congratulate her on her new position, and certainly extend a really warm welcome to Deep River and North Renfrew Long-Term Care. Thank you.
Hit it twice there. Thank you, Councillor Doncaster. With that, then, committee, we will go back to item number 1 on the Long-Term Care Department report, the Bonnechere Manor resident statistics. Miramichi Lodge resident statistics. The Champlain waitlist information. The COVID-19 pandemic update. Ms. Sheedy, please.
Thank you, Mr. Chair. I do have an update just in from Dr. Cushman. So if you'll give me the latitude, I could basically just read it.
We'll take that as an addendum.
Okay, given, as we indicated, that the staff member has been asymptomatic throughout this, Dr. Cushman has advised that this individual can return to work. As I mentioned, we are still waiting on results of tests that we did with the residents. And he's just indicated that they just received a number of them back. So they're just going through them as we speak. So what he's asked us, we're not considered to be an outbreak. He's saying we're in suspect with heightened measures. And so what we've done is on those 2 units, those residents aren't leaving those units, i.e. mixing with our other residents and those kinds of things. So it is good news, and we'll continue on that path that we have been on. Thank you.
Thank you so much for that update, hot off the presses, Ms. Sheedy. Very much appreciative of that. I think it bears repeating often that it is surveillance testing. There is symptomatic testing still happening, but surveillance testing is being undertaken, as I understand, twice a month with respect to staff. That this was surveillance testing so as to underscore in particular that asymptomatic is a particular definition. So if someone is not showing symptoms, there is no expectation of them to isolate. But upon taking the test, that this staff member did so self-isolate, and now in the follow-up test has been found to be negative. So very appreciative that all of the appropriate protocols are in place, and that in fact the appropriate protocols are in place even in following up on this, that it is not an outbreak, but it is still in a suspect category. So I think that is important to bear in mind. Warden Robinson.
Thank you very much, Chair. I just want to make sure that I am and everyone else is clear in the process of what happens with these tests. So Shelley, you indicated that the health unit has the results. So to understand then that when you have someone on from your staff or a resident who's tested, the test results go to the health unit before they come to you. Is that correct? And I'm just wondering what the lag time is in that.
Through you, yeah, thank you. Through you, Mr. Chair, to the warden. Yes, the results, the health unit notifies us of any positive results. Like any one of you, when you are COVID tested, there is a website that you can go on and see if your test result is positive or negative. So our staff definitely can do that. And our staff do that in terms of resident results as well. Sometimes we can access those a bit quicker. We have not had any issues with the lag time hearing from the health unit. The lag time has been as a result of lab capacity that, our chair has been very vocal on in our EOC meetings, etc. So if I take this example, again, test was done on September 2nd, result was September 6th. I think that's 96 hours. A far cry from 24 or even 48 hours. So if this person had been positive, it does make one question why we are doing 100% staff surveillance, because they're continuing to work in all of this lag time of getting the actual result back. It's really fruitless. And as you can see, it's bogging down the system even more. It is that vicious cycle.
Thank you for that, Shelley. Councillor Murphy.
Thank you, Mr. Chair. So Shelley, you kind of answered the question, but the newer tests were done on this past Sunday, and it's now Wednesday. Do we have an indication as to when you'll know what these test results are? Because it does seem like a really long time.
Ms. Sheedy, please.
Through you, Mr. Chair, to Councillor Murphy. It varies. We've indicated through our EOC meetings, and I can't recall if I've mentioned it at Health Committee, but typically, our experience has been somewhere in the 48 to 72 hour range, but it is not uncommon that it is longer than that at times. And so, yes, to be clear that the retest of the individual that was done on Sunday, we just got that result this morning, Wednesday. The test results, the swabs that were done on the residents as a result of potential but unlikely risk on Sunday, we don't have those results back. Dr. Cushman has just said they're starting to come in and they're just looking at them right now. So again, it's Wednesday.
Thank you for that, Ms. Sheedy. Anything further on the symptomatic and surveillance testing? I'm just going to wade in briefly that I have been raising this on the emergency calls. If perhaps a committee will recall the initial document that was rolled out, I think that was late April, early May, on what how the reopening, if you will, was going to be stood up. Within that document, I identified that contact tracing, testing and contact tracing was going to be the means by which the comfort that we could take in being able to pinpoint where COVID would make its presence known in very short order and respond in a timely fashion. In that document, it had suggested that test results should be known and contact tracing begun within 24 hours, 90% of the time. Now, that has certainly the testing regime in the province has been stood up dramatically. Committee will recall the state of emergency was declared on St. Patrick's, which is a particularly memorable day for me and my community. At that time, I think the provincial capacity for turning over lab results was something on the order of about 600 to 700 per day. By times, I know in the province now, we have hit in excess of 30,000 per day, but it is enormously variable. I have checked on the provincial website dashboard each and every day. From that, though, is the concern, I think, is the one that both Warden Robinson and Councillor Murphy had identified. If we are routinely not meeting that, it has not had an impact to our long-term care homes or to our community at large at this point. But someone else suggested in that document that 24 hours is a critical period. So in the first instance with the surveillance testing, and I will suggest that perhaps surveillance testing is seen through a different lens as symptomatic testing, but nonetheless, that was 4 days, 96 hours, as Ms. Sheedy had recognized. Even after having had a positive result, we still waited something in the order of 60 hours and thankfully turned out to be a negative test upon the subsequent retesting, but that's 60 hours. So I know that there's been conversation at the emergency call of perhaps initiating some investigations to determine if there are any protocols in place that perhaps at a future meeting of the health committee, we might be able to provide perhaps some more illumination to this issue. But certainly that 48 to 72 hours in the context of what the province is suggesting is the appropriate timelines is deficient.
You're muted, Mr. Chair.
I keep hitting that twice, unfortunately. Rebound. I'm going to go through the bullet points in item number 4, rather than simply the number itself. Anything on the family visits? On the preparation for the second wave? I have to commend, those were very dense documents. Ms. Sheedy, I have to commend you and your staff and certainly the family councils. I expect that there was a considerable effort marshaled to put these together for the deadline that the Ontario Health East was seeking. They are incredibly information dense and it took a lot of work. So commendations to you and all that were involved in that. Residents' absences. I just want to speak to, there was unfortunately, and I know that in the pandemic response, we are somewhat feeling our way through. There is no playbook for this. When this was first rolled out, it was unfortunate. The announcement at the time, it was on a Friday that the province announced these short stay absences from long-term care. That it did present some challenges early on because these had not been disseminated thoroughly across the long-term care sector, or even to Advantage Ontario. So it is highly unusual and inappropriate, I would suggest, that these measures are put in place without giving some fair warning to those who are administering long-term care, both for the safety of our staff and residents, but also for the reassurance of their families. Having said that, I am pleased at this in the end. Certainly the picture of Mr. Irving, I think, speaks volumes. This might be reused again, I think, for perhaps virtual Oktoberfest. It would be appropriate, I think, in that setting as well. This is an incredible gentleman, so I'm thrilled that he has provided now this opportunity to get back out into the community. And I think it is appropriate to recognize perhaps we are in a lull, the dead calm perhaps before the second wave, but that we are affording our residents somewhat of a return to a semblance of normalcy at the very least. Anything on the staffing? Councillor Bennett.
Thank you, Chair. Through you to Shelley. Because there is a staffing shortage, is there any information that we could have as councillors to give us any idea where to send people that are moving to our community that are interested in long-term care, being a staff in long-term care? I do have 2 individual parties in my municipality that are moving this way very shortly, and they would be, they are in care down towards the GTA area.
Sorry, I keep hitting that damn thing twice. Ms. Sheedy.
Through you, Mr. Chair, to Councillor Bennett, that's great news. We have an open-ended, i.e. no closing date, on both PSW and resident aid positions on our County of Renfrew website under careers. So if you could send them to the County of Renfrew website, that's the way to go. If not, tell them to call me directly and I can certainly help them out in that regard. That'd be great. Thank you, Councillor Bennett.
Thank you, Shelley.
Thank you. Anything further on the staffing item? Anything on the Ministry of Health Temporary Pandemic Response Division? Item number 5, City of Port Colborne resolution. Item 6, the Treasurer's reports. Item 7, once again, the Director of Care position at Monastir Manor and the backfilling thereof. Item 8, fundraising. With that then, can I get a motion to approve the report as presented? Councillor Bennett, seconded by Councillor Love. Any further question, comment, discussion? All in favor? That is carried. Thank you. There was no administration report at the time of mailing. Mr. Morrow, is there anything to add?
Thank you, Chair. Through you to committee, there is an addendum administration report that was sent out, I believe, on Friday. That contains one item, Chair. If I may, I'll proceed with that item with your approval.
Please.
Thank you. That item pertains to the social housing strategy that Shelley and Craig and other staff have been participating with REFACT consultants. The process is going fairly well. Just 2 items to report on, and that is the data that is required from the LIN. There's a bit of a lag time with respect to receiving that data. They're anticipating not getting it for an additional 2 to 3 weeks. So that puts us a little bit behind in terms of them undertaking their analysis work and then providing us with a report. So we're reporting today that we would like to extend the deadline with the consultants to November 1st. That brings it to committees in November and County Council in November as well. I believe we'll have a much better report once we have that data in hand with respect to wait lists and other critical factors. So that's a critical piece as well. The second component is a bit of an extension. I think we would like to do another blitz with respect to interviews with some of our elected officials. Some of those remain outstanding, and I think the contribution of our elected officials is critical in informing where we would like to go with this strategy for the longer term. So we would encourage you when contacted by the consultants to find a few minutes to just run through the survey questions and respond. Thank you for that, Chair.
Thank you very much, Mr. Morrow. And for committee's information, Mr. Morrow has identified that it is the chair's responsibility that he would provide the names of those who have not yet responded, and he will supply me with a bullhorn, and early in the mornings on a routine basis, I will be coming by your homes and calling you on it. Any questions or comments, committee? Councillor Lafreniere, please.
No need for a bullhorn. I heard that loud and clear. If you could send me the link again where I can fill out the survey. Was there a link provided? I know that we discussed it at a previous meeting, but I don't know if I could find the link.
Thank you.
Yeah, I believe that it may have been an email well back, I think in July actually, but perhaps Mr. Morrow, if you could redistribute.
Thank you, Chair. Through you to committee. What we will have the consultants do is redistribute the survey to all the elected officials so everyone has it.
Thank you. July, I was kind of out of town most of the month, so I appreciate that. Thank you.
Understood. Thank you.
Yeah, that may very well have explained. We are, of course, still in the COVID-dominated world as well. Anything further on the administration report? Can I have a motion to accept the administration report, please? Councillor Doncaster, second. Councillor Reguer. Any further question or comment? All in favor? That is carried. Thank you. There are no Board of Health minutes. I was remiss. I meant to address that actually in the emergency services report. One of the appendices of the emergency services report was with regards to the funding announcement for the paramedic services by Minister Elliott at AMO. Contained within that same document that I highlighted as well is the minister has committed to continuation in 2021, what I will refer to as the indemnification. As committee will recall, on the modernization of public health, while it was still underway, the redistribution or allocation of costs had been put in place, which was we had moved from essentially a 75-25 split to a 70-30 split. In the 2020, certainly I assume that this is the provincial year, but certainly for the operation of the calendar year with the health unit, each of the municipalities were indemnified, i.e. The most substantial increase that would be realized by any of the municipal funding partners would be capped at 10%. The value of that it certainly is shared with the City of Pembroke and with the Township of South Algonquin. The value of that to the County of Renfrew in 2020 was just over $500,000. That would otherwise have been required of the County of Renfrew to have supplied the City of Pembroke. I did not do the numbers. Mayor LeMay, Councillor Lafreniere, I believe that's something on the order of 12% would have been otherwise payable by the City of Pembroke. So it is not an insubstantial commitment for 2021 is to once more limit any increase to 10%. That would be a direct result of that funding redistribution. So that is certainly worth something to all of our treasuries, but in particular today to the Treasury of the County of Renfrew. Any new business? The date of our next meeting would be Wednesday, October 14th, 2020. And with that, then I would invite a motion to adjourn. Moved by Councillor Murphy, seconded by Councillor Bennett. All in favor? We are adjourned, Health Committee, for September 9th, 2020. Thank you very much for joining us this morning.